and dialogue here on Ahlebait TV. I'm your host, Fahima Mohammed, here with another topic. And I also want to remind the guests and the viewers that we are on a live show. And if you do want to call in, please do so on the number at the bottom of your screen with any comments and queries. I also want to remind all the viewers that we invite guests who are here to speak from their own thoughts and their own professional sort of awareness and information, which doesn't necessarily represent our channel, but we do provide the space to invite guest speakers to speak from their point of view. Again, without further ado, I'd like to welcome our guests for tonight. We have always with us Syed Rizvi. Assalamu alaikum, Syed. How are you today?
Assalamu alaikum. Thank you for hosting.
Very much welcome. And we have an amazing guest tonight. We have Brother Zabair Hussain. Assalamu alaikum. How are you?
Assalamu alaikum. Alhamdulillah.
Thank you so much for joining us tonight. It's really such a pleasure to have people like yourself, especially with your profession, to come on board and give your time. I really, really do appreciate it. It's such an important topic that we're going to be discussing today. As much as we speak about mental health, we're taking it from a different angle with regards to a cure, meaning in search of recovery and the different types of recovery. I'm going to let you, Brother Zabair, to start us off with regards to recovery for mental health, and talk us through this topic as we have prepared.
Sure. First of all, thank you so much for inviting me to the show. As you mentioned, this is a very important topic, and it's something which is very close to my heart as well. Working in the mental health field for around 15 years now, providing endless hours of therapy, lecturing, supervision, and teaching. One of the things that has absolutely fascinated me is our preoccupation with the cure. Will this completely rid me of any negative emotion? When we see people, when people come to therapy or seek support, they're usually feeling some level of distress, usually feeling some level of unpleasant emotion, which they are struggling to either tolerate or they're struggling to deal with. And the preoccupation is that I need to get rid of this. You need to help me. You need to get some sort of cure for me. And I think this is a societal thing as well, that often what we do see is that when we are feeling unwell, the first thing we do, we quickly reach for a paracetamol. I need to feel better immediately. And hopefully we'll talk about this more later on as well. There's something that I've seen over the years, that there's a preoccupation with positivity. I cannot expose myself to negative feelings, this toxic positivity, almost this expectation that I need to be happy, I need to be well, I need to be functioning. What we do know is that's not possible completely. As human beings, it's not possible. We go through different transitions in life, we go through different experiences in life. Those experiences impact us. And our experience to be capable in this world is directly connected to our ability to experience these uncomfortable feelings. And if we're not allowing ourselves to experience these uncomfortable feelings, how can we be capable in this world?
Absolutely. You've raised quite a lot of thoughts, very much so at the very beginning of this discussion. What came to mind first is you talking about, obviously, the positivity and a cure. But what about, there are people that when they are diagnosed, maybe they can be stuck and they're not looking for a cure because they actually now have been labeled and they think that that actually is who they are and they're kind of defined in that way. And it also sometimes gives them an excuse to continue not even taking that healing and recovery process. So that's something I want to also touch on because it's really important. The reason why we're addressing this is that there's so much talk about mental health with regards to the diagnosis, the kind of, the treatments that are available, as well as, highlighting what are the actual, causes, what are the symptoms, what kind of, ways in which we could recognize mental health. But studying, being a mental health practitioner myself, it's taken on a very different way of thinking where we actually become more accountable and take responsibility to a certain extent as well, especially when it comes to not so much the deeper level of diagnosis. Before I come to you, Brother Zabair, I want to go on to Syed. When it comes to us being resilient now and trusting in ourselves to have better responses, Syed, and obviously now that we have so much, development in the mental health industry, do you think that is actually helping us or maybe holding us back a little bit to actually use our own abilities to a certain extent to move forward with, trying to be more resilient, for example, or, taking responsibility that we are feeling in a particular way and we can actually resolve it if we had better ways of responding? Because now we seem to be expecting and having some sort of entitlement as well. We have some sort of, expectation, which can actually be a negative impact on our mental health altogether. From a religious perspective, I'm going to obviously ask the same question to Brother Zabair, but from a religious perspective, what is your analysis of now people coming like so much with, diagnosis that almost everyone, that if they cannot handle anything, if they feel something negative, it is a mental health disorder? What's your thoughts on that, Sayed?
Bismillah ar-Rahman ar-Rahim. First of all, we should look at the creation of human being. Allah subhanahu wa ta'ala has created us as a social being, and the requirement for a social being is to interact, discuss the problems, and that's what Allah subhanahu wa ta'ala in Holy Quran advises, that if you are confused, if you get stuck in your life, go and seek advice and speak to others or speak to experts. And there is no restriction on that, and Islam encourages advice. And also there is a verse in Holy Quran that nothing can be changed unless you change yourself. So the first step has to be taken by the person. So if I'm not willing to change, if I'm not willing to accept anything from others, then no change will take place. So I have many friends who are experts in this field. They all say, and I've noticed in different websites, when a client dares and comes forward and mentions their problem, the first thing they usually do is encourage the person. They don't make that person feel ashamed, or they don't create inferiority complex in that. And that's what Quranic way of guidance is also, that we should not even jump to conclusion and start being judgmental. We should give them benefit of doubt and then let them speak first, and once they have spoken, we have to encourage them, and then later on, after listening carefully, we should put ourselves in their shoes. Whatever we would have decided for ourselves, we should consider them as equal to us. I have mentioned this in my speeches and interviews, that choosing a counselor is equal to choosing a spouse. So the standards that you're looking to choose a spouse, you have to look at the similar kind of standards and understandings between you and your counselor, so you can understand and communicate with each other.
I love that. Thank you so much. And it's really important that we do hear from our scholar to encourage people to talk about this. We're not taking away the fact that people have these kind of feelings. All we're saying is that when you acknowledge this, there are steps to recovery, several types of steps. And one is obviously having that awareness, and obviously taking those steps. What are those steps, Brother Zabair, when it comes to, once you're being diagnosed, which is kind of more holistic, which is something more healthy, which is something also that is a bit more empowering to the individual? What's your thoughts on that?
Sure. First of all, I just want to echo Maulana Syed's words that Alhamdulillah, this is completely true. This is what we see in therapy, that a person takes some ownership, some responsibility in the therapy process. And this is engagement. There's responsibility on the therapist and there's responsibility on the client as well. And engagement is very, very important. We cannot help ourselves if we have that mindset that nothing will change now, I have been diagnosed, it's all doom and gloom now, nothing is going to change
Yes.
after this, of course you will not change. So the first step, which is a very daring step, this takes a lot of courage, it takes a lot of strength. People often see going to therapy as a sign of weakness. In fact, this is completely ironic because it takes a lot of strength and courage to come and speak to a complete stranger about difficulties. You're putting yourself in a vulnerable position. And therefore, this is the therapist's position to think about, how do I contain this vulnerability now and change that vulnerability into empowerment for that client as well. And this is something about choice here as well. We have a choice to either shut ourselves away from the world and sit with that diagnosis, or we have a choice to take the corrective steps to think about how treatment will work. The first thing we need to think about when a person is going for treatment, there's many barriers in the community, unfortunately, at the moment. So there's a lot of shame of even taking that step to reach for treatment. I see so many clients that the family want to keep it in themselves. There's that worry that, if word gets out, will it go on their record forever? Will they be considered, crazy? And unfortunately, these unhealthy societal attitudes will weaken the individual even further and not empower them. So the first steps is obviously recognizing what are the treatments out there. Gone are the days, this is completely gone now, that if you have a mental illness, it's almost like you need to be sectioned or you need to be on medication all your life. That doesn't exist anymore. In fact, it's a more community-based treatment. What we do, there's facilities available within the community, and I think something which the pandemic has showed us as well, that treatment is accessible from your house. You don't even need to go far for treatment now. This is something you can access digitally as well. And of course, medication helps in some places. I'm not going to be completely dismissive towards medication.
Yes.
However, there is a strong role for talking therapies as well. Some people often
Yes.
worry that once I've started antidepressants or antipsychotics, I'm going to be on them for life now, and I'm going to be dealing with the side effects. That's not the case at all. Once you learn the skills to manage your difficulties and your symptoms better, inshallah, you can leave your medication. You can actively manage symptoms and difficulties as well. And this is what the recovery model really advocates and really pushes. Recovery is possible. It is not doom and gloom. But the secret towards this, and what Maulana has done as well, that God has created us to experience both end of the spectrum. God has created us to experience the happiness, but with the happiness comes the sadness. With the light comes the dark. We can't live a life expecting we're going to be unscathed from life. Of course, there's going to be traumas, there's going to be deaths, there's going to be grief, there's going to be difficulty. How we respond to these situations is the crux in how we deal with our mental health. Now, unfortunately, this is easier said than done. If we have grown up in very chaotic or toxic environments where the modeling hasn't been available, where we haven't been able to recognize, actually, I have a choice. I can deal with problems in a certain way, or I can problem solve. If that's never been shown to us, we have to be non-judgmental. We have to be accepting. We have to be loving, caring to that person to actually demonstrate. We need to learn these skills in adult life now.
That's very true. You highlighted a lot. And again, what comes to my head is what you mentioned about, the positivity side of things. Obviously, having to accept two ends of the spectrum. And when it comes to that, do you think that our society has changed? Because we have now developed in the mental health industry a lot, and maybe labeling a lot and putting, diagnosis on people very simply and easily nowadays can actually distort a human from actually taking that ownership, because all of a sudden, in the past, when we had grief, when we had society that would deal with much more detrimental environments than what we have now today in this world, that we cannot handle simple things, and all of a sudden we become anxious and we're diagnosed with depression because we're sad over a certain amount of time, which was also normal before. Not to say that because we have grown that is a bad thing, but at the same time it kind of takes away from us actually accepting that this is life. As we know, even as Muslims, life is a test, it is a struggle. But now we want to take away that. And if we can't take away from that, we diagnose it and then we stay with it. So again, I'm coming back to that because I want to go focus on that a little bit more. Again, I'm not taking away from the fact that people do actually feel this. I deal with this myself as well. And a lot of people call me boot camp coach because it's not very easy to come to me for coaching when it comes to any of this. And I have a different way and I do warn people. But sometimes I find that it actually works. And they thank me for the fact that I'm actually a little bit tough. Because I think a lot of maybe parents mollycoddle it. They don't have the skills to deal with this kind of thing, and they get scared by something like this. When when sometimes we need a little bit of that push and encouragement, but in a healthy way, not necessarily just going down that route of just being diagnosed and staying with it, and then saying, oh well, my daughter's anxious now, and let's just leave it, and then we just like mollycoddle around it, sugarcoat it, put wrapping around it, and we just don't really deal with it properly because now we've diagnosed that person. And that's who they are, and it becomes their identity. And I think that is what I'm hearing more and more. And it's really scary that we are now having a new generation that is built upon this mindset just because they have these new words that can label them. What is your thoughts on this, Dr. Zabair?
No, I understand what you're saying. I think there's a good point there. I think if we think about changes in life, I think if we look at first generation, second generation, people who came to this country, they had very practical needs and practical difficulties. So I think their priorities were very different. We just need to earn, put food onto the table. I think society and life was less complex. And if we look at society and life now, it is much more complex. With technology, unfortunately, comes complexity as well. So we've got the demands of social media. There's much more priorities and demands now, which previously were not there. When it comes to diagnosing, we need to think about what's the role of the diagnosis? What's the usefulness of the diagnosis? What will it give me? Will this give me a ticket to suggest that, okay, I am excused now from XYZ activities because I am depressed, I have this label? But that's a very disempowering process because that takes the empowerment away from the individual. And this is something that we often work in therapy. It's changing the relationship with your mental health. I am depressed. I suffer from depression. So it's, for example, if you break I am not, and my leg is broken. And this is the differentiation we need to make. But unfortunately, equally, we are living in a city at the moment where there's an emphasis on staying safe. There's an emphasis on feeling good, looking good inside and on the outside. And again, that toxic positivity can have a detrimental effect on a person suffering from mental health problems as well. And as a society, it's very difficult because we often see, and I don't mean to label here, I don't want to generalize here as well, that once a diagnosis is given, yes, many do open up for that person, but equally, we need to think about how are you still living a decent quality of life? How are you still living independently and well?
Absolutely. I love everything you're saying, and it's really important that we do analyze this. Syed, do you feel that in this generation we are less resilient, we are less, able to be uncomfortable and deal with it, and then all of a sudden, we are now labeled, you only need to be 2 weeks if you tell a GP that you are feeling sad, and and there's a list of things without even a proper psychologist there, then all of a sudden you have, a diagnosis of being depressed. And that's what it says, at the end of the day. Whereas in the past, listening to another generation, they dealt with much more suffering. They had much more tough life, as much as there is, basically a lot of pressure now, but the pressures before even, or even people that are living at this very moment that are, in war, that are in tragedy, that are in, other places, they cope and they still live. How do we compare with that? Do you think this generation in sort of like with technology, it's actually more detrimental, not because it's affecting our mental health in the sense that we have to be diagnosed, but we're maybe sometimes getting a little bit lazy. We may be sometimes having a higher expectation of happiness and positivity when the realistic idea of living life is actually what is, meant to be a little bit of a struggle, and being okay with that struggle. What's your thoughts on that, Syed?
Yeah, There is no doubt that in the past, when all these gadgets and social media and all these uh, things for communication and interacting with each other did not exist, people used to depend on each other more. They would visit each other, they would talk to each other, they would physically embrace each other and discuss their problem. Uh, and nowadays, when all these development has taken place, although I was listening to a youngster, he was saying that I am more in touch with my family after using these gadgets. But in reality, he is not in touch because he may be
Yeah.
talking to his relatives all across the world, and but within the family unit, everybody sits separately and does not help each other, does not support each other. Uh, so there are pros and cons in previous lifestyle and the modern lifestyle,
Hmm.
and we have to discover a middle way where we should not
Yes.
get rid of what existed and take advantage of what we have in our hands and maybe use it in a better way. I have personally witnessed that if I was dealing with a family dispute and everything was online because of the lockdown situation, I can imagine
Yes.
if we were together in one room, somebody would have got hurt or killed or harmed by being together. So I said, thank God, because of lockdown, we are not physically dealing with this in one place. So there is advantage from that point of view, and Alhamdulillah, that matter allowed everyone to shout and scream and swear and do whatever they like without harming anyone. Although they might have created mental scars in other people's mind, which the psychologists and others have to sort it out later on. So I mean, we have to take advantage of both facilities. We should not
Definitely. No, I love what
totally
you're
get rid,
saying.
we should not totally get rid of the social interactions which used to exist in the past, and we should not totally denounce the modern technology.
Absolutely. No, of course, having the balance is key. What's your thoughts, Zabair?
Sure, absolutely. Just touching on Maulana's thoughts again, something really important to think about is what is happening in the family and the dynamics in the
Mm,
family, especially
mm.
when a child or a teenager is diagnosed with a mental health problem. And again, when we're formulating in therapy and thinking about this in therapy, we look at how the parent might be dealing with the illness as well. And often what we find is we need to think about this. This is evolutionary. I'm not blaming the parents here. I totally understand this passion. This is evolutionary. Of course, if your child is unwell, you are going to give that child more attention. If that is unwell,
Yeah.
if you're going to really kind of around them, show them that love, show them that support. Unfortunately, in the long run, what can happen, they might be enabling that helpless
Yes.
patient kind of narrative in the
Mm-hmm.
child. I
Mm-hmm.
understand why the parents do it, because I think I would naturally do it with my child, that I would be very, loving, protective. But unfortunately, what can happen, and this is why psychological intervention is very important, and education is very important on certain roles, that we need to recognize how I towards that illness and diagnosis as well. How am I enabling the family member to maintain that diagnosis as well? Often what happens, the parents, and rightly so, this is human nature, isn't it? When we see somebody ill or poorly, what's the first thing we do? We try to love, soothe them, comfort them. But unfortunately, in the long run, that can be quite disabling, because we're not giving the child the resilience, the skills which they have got, their
Exactly.
own inner
Mm-hmm.
resilience, to let's jump out of that. If it's temporary, that's fine. This is human emotion again. This is not
Yes.
blaming the parent. This is compassion, love, and values as a family. We huddle around, don't we? If there's a death in the family, what do? We huddle around. But long-term huddling, long-term caring and smoothing can turn into smothering. And that's when it becomes
Yes.
detrimental and the child loses his confidence then, because the parent is giving a message here that you are not able or capable to do your own thing.
I think you've touched on something really, really important. And for me, I'm hearing that we need more support, not just for the person that's diagnosed, but for the people that are supporting that person around them, and to give the education for the family support or the carers or the guardians. Because I think, that is lacking. Because like you said, even if that person is, getting treated by a counselor, a therapist, whatever it may be, a coach, they need also to have the sort of like, coaching or therapy around the family unit, if that's who's taking care of them, so that they can also have that holistic way of managing that sort of position that they're in. So that's very important. And again, there's no cookie cutter recipe or ingredient or some sort of like what we're not here is not diagnosing and telling you this is what it is, because I think every situation is different, every family is different. Even if with a child's age or an adult's age or what they've gone through, it will all depend on that specific scenario and situation as it is. We're just highlighting, general generic talks around it so that you can open up your mindset, your insight as to if someone's dealing with it, am I really helping? Am I really enabling? And the other question, most importantly, is we are looking for something as a cure. I mean, like you said, is it something that we should even question if there is such a thing as a cure? Is that the right question to ask? What is your thoughts on that? Zabair, so please go ahead.
Sure. The word cure, it triggers me. For example, if you go to your doctor for a headache or a migraine, they might prescribe you something. We see that as a cure. If that was a cure, you'd never ever experience a headache in your life again. This is not a cure. Think about diabetes. There is no direct cure for diabetes. It's management and management of cells. Similarly, we need to start looking at mental health through the same lens as well. I see so many families spend thousands and thousands of pounds. I've been to 10 psychiatrists. I wanted different diagnoses. I've paid for thousands of pounds of therapy sessions, but my child is still not cured. Even therapists fall into the traps sometimes that I want to cure, or they want to take their grief away. What again we are in, these emotions are not bad, they're not negative, that we should be fighting them, getting rid of them. These, we need to change the language. These are unpleasant emotions: sadness, shame, anger, vulnerability, embarrassment, frustration, disappointment. These are emotions we all experience. And once you master these emotions and once you learn to tolerate them, you will empower yourself. You are your cure within you, as Imam Ali alayhi salam said, that the cure is within you, but we need to open up that cure. We need to expose ourselves to what is scaring us and those difficult emotions. And often I see this in therapy. If I'm dealing with a trauma case, it's often when I start digging deep, the client might disengage because it's bringing up some really difficult emotions for them. They can't tolerate that emotion. They're struggling with it. But it's in those difficult conversations, in those discomfort, that's where true growth occurs. That's where the cure lies.
Absolutely. But do you find, especially in our faith, in our communities, in our cultures, that, there might be a little bit more restriction into adapting these sort of methods that you even sort of like put forward? Because at the end of the day, we don't really have these uncomfortable conversations. We don't want to address these kinds of issues. And even just having normal taboo topics between parent and child is not necessarily done. And again, if you come from faith, it's like, you do your rituals, you do dua, you pray, and that is a really big, being spiritual is a big part of, curing it. But again, being holistic about it, because at the end of the day, even Allah subhanahu wa ta'ala encourages us to use modern day science, technology, and development for us to actually have that. So it encompasses within our faith to actually take that further help, but we are still very resistant. So what is the kind of difficulties as a therapist yourself that you come across, especially in our communities, that if anyone's listening today and you want to really have a shout out, this is your chance to tell them, either wake up or do something, or, think in a particular way, or have an open mind or growth mindset, whichever it may be. What would be your one message that that's going to help, whether it's, a client, a family that's dealing with something like this, to actually, help this process to be a lot more easier?
First of all, I think what I'd like to stress here, if we look at our holy book, the Quran, it's extremely explicit with some difficult conversations. The Quran goes into great detail about sexual life and sexual conduct. The Quran will talk about discharges in our body. The Quran will talk about purity and how to cleanse ourselves. The Quran will talk about sexual relationships as well. Yet as human beings, as a culture, we will run away from any difficult sexual conversation. The Quran will talk about difficult emotions, grief, sadness, death. Our imams talk about this. Yet as human beings, we do not reflect the same discomfort in terms of the conversations we have. So I think the giveaway method that I'd really like to stress to the community is that once we start talking about these difficult conversations which already exist in our religion, you will see your life changing, because this is how true emotional intelligence occurs. Knowledge is power. Once you understand yourself and your emotions and why you react
Absolutely.
in certain ways, alhamdulillah, the rest is much, much plain sailing. So having these difficult conversations first is the biggest challenge.
Absolutely correct. Syed, what's your thoughts on that? I mean, do you think there should be more conversation even on the member with regards to not just addressing these taboo topics, but actually encouraging, families, households? Because as Brother Zabair has, correctly highlighted, that it is everything of those difficult conversations are mentioned in the Quran, but we're not actually having this at home. And again, it's culture taking over, which is amazing in many aspects, but the ones that is holding us back and actually, maybe enhancing some of the mental issues because, people are not open enough to speak. What would be your steps forward if, to create better conversations which are uncomfortable within families? What would be your thoughts and your sort of advice on that?
I would say that if you look at the verses of Holy Quran, which discuss problems in the society and difficulties and arguments and issues like that, the conclusion or end of the ayah is that a majority of people who end up in this situation are ignorant. That means they don't have the awareness. Or majority of the people who end up committing wrong or sin or atrocities to others, they don't have enough knowledge. They don't have awareness. And أكثرهم لا يعقلون لا يعقلون لا يفهمون لا يتذكرون. They don't remind themselves. Also, this shows that reminders are for us human beings very important. That's why Allah subhanahu wa ta'ala keeps on reminding. So we as a human being or in the modern society, we should also go to the professionals to remind ourselves to keep us up to date in the society, in our life, what is going on. So this it's whole of Quran teaches that we should ponder, we should think, we should make ourselves aware, and we should purify ourselves. Then problems can be solved. If we ignore all of this, we cannot achieve the first first step.
But many in households today, they have maybe some of the knowledge and they actually have the information. But unfortunately, because again, it's shameful. And, you get this word constantly, especially in the Arab community, it's shameful. Don't bring this up. Don't talk about this. Don't talk like this in front of your mother, your father. How can you talk about something like this? What would be your sort of like response to that, Sayed?
Well, I mean, there are narrations and teachings of Prophet Muhammad and Ahlebait that in these matters there is no haya. Haya means when you want to learn something, don't be shy. Go and ask. Ask the question, and if you don't ask the question, you will never be able to solve the problem. This reminds me of myself. I had gone to the holy shrine of Imam Raza in Mashhad, and a young lady came to me and she asked me to speak to me privately. I said, okay. And she said, I have come a long way for ziyarat, and suddenly I have started my period. What shall I do? Can I go inside or not? I said, no, you should wait until you have done your ghusl and then later on you can go. Then when I finished answering the question and came back to the group I was, one of the older ladies asked me, what was the question that this lady wanted to ask you privately? I explained this was the question. She said, astaghfirullah, astaghfirullah. They don't have haya,
Exactly.
they don't have. So I said, if she had not asked the question, she would have ended up committing something which she should not have committed. So what's wrong in her asking this question? So
Exactly
yes,
my point.
we have to break, we have to break this taboo and ask the question. I mean, I was dealing with another case today. The whole problem is that they are shy of each other. They cannot express
Mm.
what they feel and what they like and what they want.
Absolutely. We have all these problems in the household. That's why we have these shows today so that we can actually tackle them. I mean, I know I have an insight that most people don't dealing with it. And so does, Syed as well as Brother Zabair. So that's why we have these guests and amazing conversations that we are only here to speak because we want to create better homes, better households, better relationships. And it does include having these really difficult, uncomfortable conversations. It starts with you. And yes, you can talk to a professional, and which is amazing to get that. But it would be even better to also have the support and the system also at home so that you can actually, go back and reflect with your family members, with your siblings, even with, other relatives, if it's possible, so that you can actually have, someone to give you that support outside even professional help. We also have a culture of perfectionism and, having, acceptance and things like that. And we do need to change the narrative of mental health. It's not all doom and gloom. What would be your thoughts on that, Brother Zubair?
Sure. I think the perfectionism, we see that in all aspects of our life from an early age. I must get the best scores at school. I must have the best physique. I must have the best clothes. I must perform the best in my recitations, in my prayers. I've recited this much this week. How much have you recited? And then this perfectionism goes forward into adult life. I need the best house, the best
Mm-hmm.
spouse, the best car, the best profession. It's endless. It's relentless, and it is endless, and it's the self-defeating prophecy at the end of the day. Unfortunately, all that occurs is burnout occurs, high levels of stress, anxiety, depression,
Mm-hmm.
and criticalness occurs, unfortunately. And unfortunately, I think as a community, this might be a generalization, but I think it's fair to say we can be really critical of each other. We judge each other
Oh,
through our
yes.
material gain. We are extremely, you're not married by this age, what's wrong with you? Or you don't have this house, this mortgage by now, what's wrong with you? We become extremely critical. And again, it's changing that relationship into much more compassionate language and compassionate dialogue we have with ourselves, but also the people around us as well. This is extremely important. And this brings me back to Maulana's point, which he made earlier as well, about integrity, haya. When we have these conversations, it's very important that we maintain the other person's integrity. By being critical about the other person, integrity has gone out the window. In fact, we're losing our own integrity by judging somebody like this. So this is why compassion is extremely important, and this is fundamental in Islam. And all world religions teach compassion. There's no difference. This is not a new concept. It's nothing bizarre to do this in Islam. It's basic concept in all major religions. If we learn to be compassionate and accepting of ourselves, and tolerating to be in our own skin as we are, we
Mm.
will start
Mm-hmm.
tolerating the world around us as well much better.
No, that's very, very good advice, and it's very much highlighting and sort of close it up really nicely. I think it's really important that we do have more acceptance, but I do find that it's going to take another generation for the older generation to get used to the differences, and also hopefully, inshallah, we have a new generation that's going to be a bit more open-minded, in a sense that we're not going to lose our cultures and our identities, but we're actually going to be moving forward in a much more healthier way, especially in our home, because the mental health is really, really toxic. And now it's touching, really young minds where where is the hope of the next generation when we cannot even have the basic sort of like ways of responding and managing, some, tolerant sort of, activities and, ways of being resilient and ways of being, accepting that it's okay to be uncomfortable. It's, failure is only feedback, for example, things like that, which we learn when you are in the self-development world, but we're not developing, unfortunately, enough. So hopefully with people like yourself and Syed that are dealing with this, and hopefully we can collaborate even with the scholars as well as professionals like yourself, which we need to combine the both. And hopefully more discussions and conversations like this is definitely needed. We have a minute or two, so I just want to quickly give you both a chance to give like a closing statement before the end of the show. So Syed, I'll start with you, please.
We should never give up in learning. We should continuously educate ourselves and increase our knowledge, and that is the key for getting rid of all these prejudices.
Absolutely, I definitely second that. What about you, Zabair?
Yeah, alhamdulillah. I think I just want to add that we run away from these unpleasant emotions. We think we might not be able to control them, or we lose control, we'll become overwhelmed. It will be a scary experience, but once we start tolerating this distress, sitting with this distress and tolerating that distress, you will empower yourself. And I think just a little tip for families: often we schedule in screen time, time to watch movies, time to go see family. Scheduling in maybe check-in time once a month or once a week with your children, even with your partners, even with your siblings, just check in unconditionally,
Yes.
unjudgmentally. How are you? How are you feeling? Having these non-judgmental conversations can make such a difference, and reach out for help. There's no shame whatsoever about help. And something that I really want to stress when thinking about a cure, okay? Relapse
Yep.
will happen regardless. And this is really important. What can happen? There's a difference between lapse and relapse. Sometimes people are constantly worrying, oh, I've done really well, but now I've gone back to square one. That's not the case. You're probably having a lapse. We all have lapse. I have bad days. Bad days. This is completely normal. Again, let's jump out the perfectionism that I can always be good or on this high all the time. It's accepting myself as I am, my good and bad.
Brilliant. Thank you so much, Syed, and thank you so much, Brother Zabair. If you do need to reach out to him, please do so. He's got amazing expertise behind him, and do reach out for any sort of help to our Syed as well as Brother Zabair. Thank you so much for both of you. Thank you so much, all of you that are watching tonight. We really hope that this opened up a conversation that's only going to help your situation if you are going through it. If you do need to seek help, please do contact, your local GP or any other professional services, because this is a very, very important issue that you should not really ignore. Thank you so much for watching tonight. It's been an absolute pleasure to host and to also be part of Open Dialogue. Again, inshallah, we'll watch and we'll see